The white blood cell count, also known as the total number of leukocytes in circulating blood, is a core component of a complete blood analysis. This measurement reflects how many immune cells are present in 1 microliter of blood and offers important information about infection, inflammation, immune function, and bone marrow activity. White blood cells originate from hematopoietic stem cells inside the bone marrow. These stem cells separate into 2 main developmental pathways: myeloid pathway, neutrophils, eosinophils, basophils, and monocytes; lymphoid pathway, T lymphocytes, B lymphocytes, and natural killer cells. Each of these cell types carries out specific roles within the innate or adaptive branches of the immune system. In healthy adults, the normal reference range for the total number of white blood cells is approximately 4 billion to 11 billion leukocytes per liter of blood, or 4,000 to 11,000 leukocytes per microliter. Medical professionals interpret the total white blood cell count together with the differential count, which displays the percentage of each major white blood cell subtype. This combined information offers more precise identification of underlying immune processes. An elevated white blood cell count, called leukocytosis, occurs when the number rises above the upper limit of the reference range. Common causes include infections, especially those caused by bacteria, typically associated with increased neutrophils; inflammation, including autoimmune disorders, tissue damage, or trauma; physical or emotional stress, exercise, surgical procedures, or acute emotional stress; smoking or obesity; medication effects, including corticosteroid medications or beta-stimulant medications; bone marrow disorders, such as chronic myeloid leukemia, which may produce extremely high leukocyte counts. A microscopic examination of a stained blood smear is often needed to evaluate cell appearance, maturity, or the presence of abnormal immature cells. A decreased white blood cell count, called leukopenia, occurs when the count falls below the lower reference limit. Possible causes include viral infections that temporarily reduce bone marrow activity; bone marrow failure or dysfunction, including aplastic anemia or myelodysplastic disorders; immune-mediated destruction, as seen in systemic lupus erythematosus; medication-induced suppression, such as chemotherapy, antithyroid medications, or certain seizure control medications; nutritional deficiencies, including inadequate vitamin B12 or folate level. Low neutrophil levels, known as neutropenia, are especially significant because they increase the risk of severe bacterial infection. Understanding abnormalities in the white blood cell count requires evaluation alongside multiple factors. The differential count showing proportions of each leukocyte type; clinical symptoms, such as fever, weight loss, or enlarged lymph nodes; other components of the full blood analysis, including red blood cell counts and platelet counts; findings from a peripheral blood smear; bone marrow examination when medically necessary. One isolated white blood cell measurement is rarely diagnostic on its own. Instead, it opens a pathway for more comprehensive clinical investigation. The total white blood cell count is a dynamic indicator of immune system activity and bone marrow health. When interpreted together with differential information and clinical context, it helps clinicians identify infections, inflammatory processes, bone marrow disorders, and systemic disease. Accurate interpretation of this measurement is essential for effective diagnosis and patient care. Thank you for watching.